Good afternoon, everyone. I'm Dr. Grace Olive, and my topic for the free paper is Neutralizing Antibodies to SARS-CoV-2 in Healthcare Workers, a Response to Vaccine or Exposure. The risk of contacting COVID-19 is higher in the healthcare workers owing to their occupational exposure, and healthcare workers working in the Gandhi Hospital Secunderabad, an exclusive tertiary COVID center for Telangana state, were at highest risk compared to the others. Due to this, the healthcare workers were vaccinated on a priority basis. And SARS-CoV-2 induced immunity, either through the natural infection or vaccination, has been shown to afford a degree of protection against the disease. Serum neutralizing antibodies rapidly appear after the SARS-CoV-2 infection, and the vaccination are maintained for several months. Among the structural proteins, including the spike protein, envelope, membrane, and nucleocapsid proteins, IgG-M and IgG antibodies produced against the spike and the nucleocapsid N are commonly measured. My aim is to detect the presence of neutralizing antibodies to SARS-CoV-2 among the healthcare workers of this tertiary COVID center. And my objectives are to detect the neutralizing antibodies in response to vaccination and to detect the antibodies in healthcare workers who are exposed to or infected with COVID-19. My type of study is observational. I have 162 individuals as my sample size. The sample taken was serum, and the study period was June and July of 2021 year. Healthcare workers of a tertiary COVID center and all those who have given consent for the study are included in this. My method. We had collected 5 ml of blood from the individuals, and the serum was separated, stored at -20 degrees for testing. The specimens were tested for the SARS-CoV-2 neutralizing antibodies to the spike protein S. COVID-19 neutralizing antibody microLISA test kit was used for the antibody detection. It's an enzyme immunoassay based on blocking ELISA. The cutoff OD values above 30 of inhibition were taken as positive for the neutralizing antibodies. The kit sensitivity was given as 94% and specificity as 100%. The test procedure is given here, where we have had a pre-mixture where we incubated the sample with this premix of RBD HRP, and then it was incubated for 30 minutes, and later on the blocking ELISA method was done. We see that those samples which had the neutralizing antibody showed a lower chromatographic effect, and those which did not have the neutralizing antibodies or had the non-neutralizing antibodies showed higher chromatographic effect. Through this, we would read the optical density meter, and then we calculate the inhibition percentage. My study subjects included male to female ratio of 5:4. And the individuals in this study are the unvaccinated with previous infection, unvaccinated with no previous infection, vaccinated with previous infection, and vaccinated with no previous infection. The details of this has been given as in the chart. My study subjects majorly had doctors, that is 102 of the 164 individuals. 28 of them were lab personnel, and the others were administration and other departments. Among these study groups, I have shown that vaccinated individuals were higher among the doctors compared to the other two groups. My results: 65.4% of the vaccinated individuals were positive, and 58.62% of the unvaccinated individuals were positive for neutralizing antibodies. So among the 162 individuals, 133 individuals were vaccinated and unvaccinated individuals were 29, and the percentage of negative and positive is given as in the chart. All the inhibition values above 30% were considered to be positive for neutralizing antibodies as per the kit instructions. So the mean percentage of inhibition for positivity of these 104 individuals who tested positive is 77.61. And among these, the inhibition percentage, there's no particular division among mild, moderate, or high positive antibody titers. But for understanding, I have divided them as 30 to 50% as mild positive, and 50 to 70 as moderately positive, and 70 to 100 as highly positive for antibody titers. Among my results, among the highly positive antibody titers, we have observed that most of them were vaccinated and had previous infection, and those who were vaccinated and had previous infection had better advantage compared to those who were not vaccinated but were only infected. And the age group, 21 to 30 showed the highest positivity rate of 69.2% for antibodies. And among the 29 unvaccinated individuals in this study group, 15 had prior infection, of which 73%, that is 11 of the 15, were positive for neutralizing antibodies. And of the 14 individuals who were unvaccinated and had no prior COVID infection, 42%, that is 6 of the 14 of them were positive. This can be attributed to exposure. And coming to vaccination, depending on their first dose of vaccination, I have divided them into 6 months, greater than 6 months, 5 months, 4 months back, 3 months back, 2 months back, and 1 month back from the time of my study period. And when we have calculated the percentage of positivity among these individuals, those who had taken their first dose 4 months back and completed their second dose from 1 month to 2 months back had the highest positivity rate for neutralizing antibodies. Neutralizing antibodies were detected in the vaccinated and unvaccinated individuals. Some of them had previous infection to COVID-19. So the antibodies were higher in those individuals who had been infected with SARS and were vaccinated in comparison to those who were vaccinated but not infected. So these results correlated with the study done by Gabriel Anici et al. From Siena, Italy. And there were 6 individuals who were unvaccinated, not infected, but were positive for neutralizing antibodies. That is 3.6% of the total study group. This correlates with a study done by Jose Xavier Morales of Guadalajara, Mexico, who had 3.2% positivity for antibodies. No substantial difference was noted between the titers from previously infected or previously uninfected individuals according to their age or gender. My conclusion, neutralizing antibodies were almost similar in positivity for both vaccinated and previously infected individuals. In those individuals who were unvaccinated, not infected, positive antibodies may be attributed to asymptomatic infection due to exposure. Based on the time of being vaccinated, antibody titers were found to be diminishing in half of individuals after 2 to 3 months of receiving the second dose. And the exact cause of why only some of them showed this trend is unknown. Limitations to this study include a small sample size, possible selection bias, and how neutralizing titers correlate with protection.